If you are watching this, chances are your lower back feels stiff, achy, or completely locked up. You might have been sitting at a desk all day, or you simply woke up with a dull, nagging ache that refuses to fade. You do not have to just grit your teeth and live with it. We're going to walk through a 6-step clinical routine you can do right now to find immediate relief, release tight muscle knots, and reclaim your mobility. You only need a few basic items from around your house to get started: a comfortable mat, a standard tennis ball, a clean tube sock, and a soft pillow. There is one golden rule before we begin. Move only within a comfortable range. You should feel a gentle stretch, but if you experience any sharp, shooting pain, stop immediately. Resting on the couch might feel safe, but a locked-up back is a mechanical problem. Breaking the cycle of tension requires deliberate, targeted movement to get your tissues sliding and gliding again. We begin with a trigger point release. Slip your tennis ball into the tube sock. This makes it easy to hold over your shoulder, and stand with your back against a smooth, sturdy wall. Lean your body weight directly into the ball to hunt around for those tight areas we call muscle knots. Once you find a tender spot, adjust how hard you lean to create a tolerable, satisfying, good hurt pressure. You might wonder why pressing on a sore spot helps. When you apply sustained, localized pressure to spasming muscle fibers, you physically force them to exhaust their energy supply, allowing the tissue to finally unclench and release its tension. Now that the upper back is slightly looser, let's transition to the floor for knee rolls. Lie flat on your back, keep your feet firmly on the floor, and slide your heels up toward your glutes so your knees are bent. Keeping your knees tucked together, slowly let them fall over to the left side. Let your lumbar spine gently rotate, but do not force your legs to touch the floor if they don't want to. Hold for 5 seconds, then smoothly roll over to the right. If your back is incredibly stiff today, place a pillow parallel to your hip so your knees land softly on a raised surface. To progress the movement and wring out the entire spine, simply turn your head to look in the opposite direction of your knees. Doing these 2 movements first is essential. They break the initial rigid guarding of your lower back, softening the surrounding tissue so we can safely move into deeper decompression. Next is the Piriformis Stretch, commonly known as the figure 4. If you sit at a desk for long hours, pay close attention because your deep hip muscles are likely locked short. Take your right ankle and cross it over your opposite left knee. Reach your hands through the gap to grab the back of your left thigh and slowly pull that leg up toward your chest until you feel a deep stretch in your right glute. This anatomical diagram shows exactly why this stretch matters. The thick sciatic nerve runs directly underneath the deep piriformis muscle. When that muscle tightens and inflames, it compresses the nerve, causing sharp, radiating pain all the way down your leg. You control the intensity here. If it feels too sharp, let your thigh drift slightly away from your chest. If you need a deeper stretch, gently pull the knee closer and breathe steadily. Let's flip over onto our hands and knees into a tabletop position. Open your knees wide, like 10 and 2 on a clock face. Keep your big toes touching behind you, and slowly sink your hips back onto your heels while letting your chest melt down toward the floor into child's pose. We can modify this to target asymmetrical tightness. By slowly walking your hands over to the right side of your mat, you isolate and lengthen the tension lines running all the way down your left flank. If you have limited hip mobility and can't sit all the way back, slide a pillow right in front of your knees. Resting your chest on the cushion decreases the required range of motion while still delivering a highly effective stretch. Relieving deep tension in your hips and flanks removes the secondary mechanical pulling forces that constantly yank on your pelvis and exacerbate your direct lower back pain. We are shifting our focus from passive stretching to active stabilization with the glute bridge. Chronic lower back pain is frequently caused by sleepy, underactive glutes that force the smaller muscles of the lower back to overwork and eventually spasm. Lying on your back with knees bent, squeeze your glutes tightly and press through your heels to lift your hips toward the ceiling. Be extremely careful not to push so high that you arch your lower spine. At the top of the movement, check your alignment. You want to create a perfectly straight diagonal line running straight from your knees, down through your hips, and finishing at your shoulders. If you want an advanced progression, Hold that bridge at the very top and perform tiny, controlled foot marches. Lift one heel slightly off the floor, set it down, and lift the other, keeping your core braced. For our final movement, return to the tabletop position for the bird dog. Plant your hands under your shoulders and your knees under your hips. Your spine must be completely flat, no arching up and no sagging down in the middle. Start by slowly lifting just one arm straight out in line with your ear, or practice sliding one leg straight back behind you. Once you feel steady, progress by reaching your opposite arm and opposite leg out at the exact same time. The vital structural requirement of the bird dog is keeping your pelvis completely level and parallel to the floor. Imagine resting a glass of water on your lower back. Your limbs are moving, but your hips must not sway or tilt. Building muscular endurance in these active stabilizing patterns creates an invisible structural corset. It protects your newly mobilized spine long after you finish stretching. Great work! You have actively moved through your stiffness, released your tightest knots, and successfully completed the routine. The long-term dosage for this protocol is simple: 10 minutes a day. Practicing these movements daily is what transitions your back from experiencing temporary relief to building chronic, lasting stability. Please remember to listen to your body. If you experience sudden weakness, numbness, or a loss of sensation in your legs or groin, stop these movements immediately and seek guidance from a doctor or healthcare professional. Take a moment to reflect on which stretch provided you with the most profound relief today, and use that insight to tailor your practice tomorrow. Overcoming lower back pain is a process. It requires a daily commitment to intentional, supportive movement. Stay active, stay healthy, and keep moving.